Nowadays, we also look at complex PTSD. So while the PTSD involved that one has to be exposed to the trauma, which is significant threat to their life or integrity, or the threat of life or their integrity of significant others, the complex PTSD is a new condition which is being seen more commonly in young people, particularly those who are coming from difficult upbringings, people who have been exposed to various different forms of trauma, such as psychological or physical abuse, partners of domestic violence in domestic abuse situations, people who have been held hostages or have been forced to work as sex workers, or other situations such as long-term exposure to bullying or kidnappings or hostages. So there are various conditions, various situations where this complex PTSD can happen. Complex PTSD is similar to PTSD in their symptoms, but they also have additional symptoms that they struggle in managing their emotions. So they have emotional upheavals. Their emotions can range from rage, anger, or intense depression, severe depression, anxiety. They start doubting themselves, the sense of worthlessness. They also feel that they cannot be understood properly. They find it difficult to relate to people. They find it difficult to trust people because they are scared that they might be tortured again or they may be traumatized again. And even when they are in relationship, sometimes they find it difficult to deal with that relationship. They have very high sensitivity to rejection as well. So if their partner behaves in any manner which indicates that they may be abandoned, then it creates a sense of re-traumatization again. And hence, we have to be very careful and aware of these conditions and seek help, particularly if people are experiencing these symptoms, whether it's for yourself or anybody that you know has suffered a significant trauma in their life at some point or over a period of time. Treatments for PTSD involves lots of things, such as we could look at the option of, first of all, assessing if there is any other comorbid conditions, because PTSD or complex PTSD does not exist alone. People start using drugs and alcohol to self-medicate or manage their emotions or to reduce their anxiety. Commonly used medications or for abuse are benzodiazepines, alcohol, cannabis, and others. So treating those conditions will be equally important simultaneously as you're treating PTSD. Similarly, PTSD can also present with depression, severe depression, anxiety, and sometimes because of the shame and guilt during the trauma, what has happened, for example, following a rape, people can develop other symptoms such as obsessive compulsive disorder, obsessive doubts about their cleanliness or being dirty, and compulsive rituals of cleaning themselves. Sometimes people can present with self-harming behaviors, such as by cutting themselves superficially, or it could be by taking an overdose of the medication. They may also present with acute psychotic symptoms. So the other conditions need to be assessed as well. They need to be treated as well. There is no drug treatment for PTSD, though some new research is coming up about use of different drugs or medications which are being trialed at the moment in research, but they have not been yet advertised or not been promoted by NICE guidelines. The mainstay of treatment for PTSD is more psychological, understanding the trauma and also building a deeper therapeutic relationship so that they can trust the therapist. They could very well start with simple CBT or trauma-focused CBT, which addresses their issues or gradually addresses the cognitive processing that a person adapts during traumatic events. Because when the trauma is happening, what happens to the mind is that the mind goes numb. You imagine yourself that you're on a dark street at night time and somebody comes up to you with a knife or a dagger and demands you to hand over everything that you got. it's highly likely, I'm not saying that it's going to happen, but it is highly likely that you will feel quite scared at that time. You may comply with their instructions, and their instructions may go beyond handing over everything. It could involve anything, right? After they leave, you still feel as if you're shaking because of the acute intense fear. Now, when you come back home, you're still feeling quite jittery. Actually, when you start talking to somebody, then you realize that what has happened. Now, when you start, even if you want to report to the police, sometimes you will feel that your memory is not giving you the support. You're feeling that as if your memory is not correct. This is what happens when somebody is facing acute trauma, their mind goes numb. So the events which are being registered in the brain, they are not being processed properly. So they're just being stored as a matter of fact, but not with the emotional attachments. When you start recalling them, unfortunately, they come back with the emotional attachments. Now, the emotions strongly attached to those memories. Now, those cause the reactions that I spoke earlier. For example, experiencing, reliving the trauma along with autonomic hyperarousal. Now, as a result, the person always goes into what we call as dissociation, that whenever they are re-experiencing trauma, they are going into a dissociative space. This is a mind's own mechanism to prevent further injury. Now, as a result, what happens is that because of dissociation, the memory which is being recalled is not being processed again. So, there is a specific treatment for such complex traumatic memories is through what we call as EMDR, which is eye movement desensitization reprocessing. You're initially taught some grounding techniques such as tapping your chin, or it could be tapping on your arm of the chair while talking about your traumatic memories. So the idea is that while you're recalling the memory, you're revisiting the past, but at the same time, you're remaining grounded to the present. You're holding on to present. You know that you're in today's date, in today's place, but you're recalling the past memory. This helps holding the two worlds together, the past and the present together. Now, over a period of time, you're taught further skills whereby you are able to remove the emotions from the traumatic memories, and then gradually refile those memories as a matter of fact without emotions attached. Why we do that? The simple reason is that if I were to ask you what you had for the breakfast 2 weeks back, highly likely you may not recall it unless you've been having the same breakfast every day. The reason being because there are not any emotions that are attached with our routine activities. But when it comes to emotional activities, then of course you will recall that you will remember your first insult in your life, or first moment of your life when you felt embarrassed, or first time if anybody praised you in front of public, because those are highly emotional memories. Now, the reason for EMDR treatment is this, that we try to help people reprocessing, reaching out those traumatic memories from deeper subconscious or unconscious level, bringing them to the forefront of conscious mind, and then reprocessing them and refiling them again, so that people are able to move on. They are not just feeling stuck with those traumatic memories. There are a few other types of treatments which are now being researched for the treatment of PTSD. As you would come to the clinic, you will find out more about them. We'll discuss about these conditions as well. Well, I would say that people with PTSD and complex PTSD, they stand good chance if they reach out seeking help, assessment, treatment of the conditions, other conditions as well, as early as possible. More you delay it, more it becomes difficult to treat these conditions.